Good afternoon and welcome everyone to our regular Leo Labor webinar series where we focus on workplace mental health. My name is Sean Egan. I'm the Deputy Director for Labor here, and if you've been participating with us, you probably are sick of seeing me or hearing me, but we're going to continue to do this work and keep pushing forward. Our regular series is monthly on the third Thursday of each month at 2 p.m. And I know for many of you that have been following us, there's been a lot more of these in May, and that's intentional. So you may be thinking now, like, what does regular mean? When we get into June, we'll get back to the regular flow. But as you all know, May is Mental Health Awareness Month, and we really ramped up the action to get the word out. And I want to thank all of you that have been participating and all those that have invited us to participate in other events. And just a quick recap, we kicked off our work on May 3rd, where we were able to lead a panel discussion for the Michigan Minority Supplier Development Council Conference at COBO. It's Huntington now, but COBO in Detroit. We had our first webinar on May 4th in collaboration with the Michigan's Women's Commission, where we focused on menopause. As an employer, we did an internal webinar on May 8th for Leo employees. We had our second collaborative webinar with the Women's Commission on May 10th, where we focused on domestic violence. We had the privilege of being in Mount Pleasant with their local chamber on the 11th. We joined Oakland County Michigan Works just yesterday. Our regular webinar today will be with our employment and training team on the 24th, and we're going to round out May on the 31st with guests from the University of Cambridge and Boston College who are going to share their findings from the highly publicized 4-day workweek study in the UK. So I'm tired, but this is an important topic, and we're happy to help spread the word, and we'll be back to our normal Thursday schedule next month, and we'll continue. So make sure that you sign up for email updates, because that's where we really get out the word. And don't forget that anytime throughout this program today that you can add a question in the Q&A box, and we'll get to as many as we can at the end of the presentation. And we have a great presentation today. So we have our partners from DHHS. They've been joining us for some of the work we've done in May, but they've been doing a lot of their own. So no doubt our guest today is tired as well. And the Stay Well program. So we talked last month a little bit about these pillars we're seeing of things that are in the workplace, like these workplace characteristics are a challenge, things affecting the workplace, and then individual behavioral health supports. And we talked about Stay Well previously as a great tool for people getting to the resources they need. And they're going to talk to us today about something new that they've launched that's going to help us get those resources into the workplace to support individuals. So I'm going to turn it over to my friend and the program manager with the Stay Well program, Erin Wallace. Erin, over to you.
Thanks so much, Sean. Good afternoon, everyone. As Sean said, May being Mental Health Awareness Month is a very busy time, and we are tired as well, but we're energized and excited to be sharing just great resources and information with all of you. Today, we're going to talk about regaining balance for a brighter tomorrow. And what does that mean? What does that look like? Just to begin, I want to give you just a brief information about the Stay Well program. Stay Well is a counseling program that's administered by behavioral health professionals at the Michigan Department of Health and Human Services, and we work in partnership with the Michigan Public Health Institute as well as Griffin Place. Right now, we're supported by state and federal funding. We have funding in place through the end of this fiscal year and waiting on our notice of award for funding for fiscal year 24. So as it says here, the Stay Well program was created to help Michiganders cope with the emotional distress stemming from the pandemic. And we really have two main components, a crisis counseling hotline and behavioral health outreach. Our ultimate goal is really to help to validate, to normalize, and to humanize the responses to the pandemic. And this means that your response to the situation is a normal response to a very abnormal situation. And it's okay to not be okay right now. What's not okay is staying with these feelings for any extended period of time. So the Stay Well program provides resources that are customized for populations that are listed here on this slide. So today we're really going to be focusing on wellness and mental wellness, whether that's individual, personal, it's team wellness, it's wellness in the workplace, and how the pandemic has impacted that. According to the National Wellness Institute, wellness is an active process through which people become aware of and make choices toward a more successful existence. And so this definition, it describes a shift from unconscious living, where you don't necessarily think about health or wellness until you don't feel well or you have a problem or you're experiencing symptoms, shifting more to conscious living, where you're more actively making healthy choices and promoting your success and well-being. And really, wellness seemed in short supply throughout the COVID-19 pandemic. It's safe to say that since March of 2020, we have lived through a variety of challenges, a variety of stressors, hardships, as well as losses. And living through a time period like this is really one thing, but then being able to process all that we've experienced, learn from those challenges, grow from the challenges, that's a really different experience in and of itself. And so it's a very large task to undertake. And so simply put, emotional recovery from a disaster takes time. And you'll see this here on my next slide. So I promise this is the only disaster behavioral health chart that I will show, because it doesn't always, we don't think in terms of disaster recovery, but the model that's shared here is really based upon what we know about natural disasters that have occurred. So think about earthquakes, floods, and hurricanes and how we process those events. The COVID-19 pandemic is a little different in that this is an ongoing disaster. There's no clear start and no clear end. Even though the public health emergency has ended, individuals are still experiencing the challenges that COVID brings about. And what social scientists have learned is that when the threat of a disaster has diminished, that's when we begin to process all that we've lived through. So when you look at this chart, notice the reconstruction period that's shown. This is when we see the most impact on our emotional and our behavioral health as well. And really right now we're seeing these impacts within various areas of our lives, within the workplace and the challenges that we're seeing within our workplaces, in our personal lives, whether that be really individually, we're maybe seeing this in our children, we may be seeing this in our immediate family or extended family members, friends, and colleagues. And what can make this really challenging is that these phases of recovery, they happen differently for everyone and at a different pace and at a different time for each and every person. And some people may not even realize that the pandemic and all of its aftermath is causing them some challenges in the present moment. Perhaps an average person would think 2020, those images that we just showed, they seem like a lifetime ago, and I had a right to be anxious then, I had a right to be distressed then. But now I don't think that those two correlate. And how is my life from 2+ years ago impacting me today? So we know that the previous life events can affect us long after an event if we don't process those events. And so I'd like us to look a little bit deeper into wellness. So when we talk about wellness, we often talk about it again in terms of being well or unwell, relating to just not feeling good. But if we take a moment to reflect on all that we've been through since March of 2020, we may begin to look differently at feeling well or feeling unwell. And when we dive deeper into areas where we may be experiencing a lack of balance, this is really where we can begin to understand all that what we really need to be well. We know that wellness is best cultivated through a holistic framework that considers multiple domains or dimensions as components of an individual's wellness. And so each one of these dimensions are a part of your quality of life. And if an area is neglected for a period of time, what you may begin to see is a negative effect to your overall health. Wellness, as shown here, is truly multidimensional, and there are several different areas of life considered to be part of overall wellness. Wellness isn't just about physical activity and good nutrition, that doesn't hurt, but it includes positive choices and a sense of fulfillment in all of the 8 dimensions of wellness. So there's a ton of conversation surrounding mental health right now, surrounding mental well-being and how, frankly, unwell Americans are at the moment. And some people think that there's been no impact since the beginning of the pandemic. Well, it is impacting us. And I'd like to share with you some of the resources that have been reported by the Mental Health Association. So the number of people looking online for help with their mental health increased significantly. In 2021, over 5.4 million people took a mental health screen online, which represented a 500% increase over the number of people who completed that screening in 2019. 78% of people that took a psychosis screen in 2021 showed at risk for psychotic-like episodes. Screenings indicated a large increase in the percentage of youth experiencing emotional, attentional, or behavioral difficulties during the pandemic. There were also significant increases in the percentage of people scoring at risk for post-traumatic stress disorder, severe anxiety, and psychotic-like experiences from 2019 to 2021. Taking a little bit of a closer look here, the percentage of people in the U.S. reporting frequent thoughts of suicide and self-harm in 2021 is the highest recorded since the Mental Health Association screening program launched in 2014. We're seeing this highest in youth that identify as LGBTQ+. People screening at risk for mental health conditions are struggling most with loneliness and isolation. And the difference in these things contributing most to mental health concerns among individuals of different races and ethnicities reveal inequities in the experience from 2020 to 2021. Among individuals who screened positive or moderate to severe for mental health conditions in 2021, 63% reported that one of the top 3 things contributing to their mental health concerns was loneliness or isolation. This was then followed by 49% reporting past trauma and 37% reporting relationship problems. So these 2 slides, they really show us that we are processing what we're living through, but the mental health crisis that was present prior to the pandemic has just grown exponentially. So we're hearing and we're seeing from people that their individual dimensions of wellness are out of balance and they're desperately needing to be restored. So how does this translate to work? Most commonly, we are hearing that people are experiencing stress because of their employment. Stress, as we know, is just such a broad term, and a lot of times people won't necessarily identify with why I'm not feeling well. It's just I'm stressed. It's kind of that blanket term for us, right? It's that all-encompassing feeling that folks can have, and it's so incredibly broad. And as we know from the dimensions of wellness, an imbalance in any area of our 8 dimensions of wellness can lead to us being unwell and stressed. And so the statistics on this slide come from research that was collected by the American Society on Stress. And day to day, we may not notice how stressed we are or how stressed our coworkers are, but these statistics are pretty staggering. So as we continue to talk about mental health and the mental health crisis, what else does this mean for our workplace and all that we're processing and experiencing in our personal lives? Well, we're seeing a few different types of trends that are emerging. What we're definitely hearing is that gone are the days of an employee works for me. It's definitely now a space of an employee works with me. And we've moved more to a phase of contributorship where we're all contributing to the same goal, and that individuals and employees are really desiring to have that goal and to feel that responsibility for contributing to that. We're also seeing that staff that are experiencing challenges in their other areas of wellness are essentially frozen in place. They're not looking for other work, but they're certainly not completing the work that they have. And they're not looking to go anywhere different. And what we're seeing is that they're setting the pace and the development of work behind. And this ranges really everywhere from essential and frontline staff all the way through C-suite executives. Staff who feel that they're not valued or in a profession that is helping them to feel better are leaving that role. According to Forbes, 70% of staff employees now demand that purposeful work. And so some of these trends have been building over time, but the pandemic really gave them that harsh push to front and center. What we've also seen and what we've heard is that employees have found their voice and they're expressing that through their feet. They're either moving toward or away from employers who don't recognize their value. And they want to be those contributors and those co-builders of vision, and soliciting feedback from staff, from team members is really going to help with that by keeping them in the loop. And when you see and when you experience those employees that become co-owners and the output is increased, that engagement is increased, innovation, collaboration, execution, and bottom line revenues then are increased. So I've used this slide for a long time. I feel like it's a great self-portrait of myself for the last 3 years. But how do we really handle all of this, especially since we know that our wellness is multidimensional and one area influences another? At work, team members are trained to be flexible and to deal with needs as they arise, whatever those may be. But the COVID-19 pandemic and its aftermath continue to play out just as a very different ballgame. So during this pandemic, employees have faced and are still facing traumatic experiences, both in their professional and their personal worlds. And we have to remember this for ourselves and for others. And we have to remember that we're all healing from the pandemic differently and at different rates. As a workforce, we've been trained to keep our professional lives and our personal lives separate. Leave it at the door is what I would tell my staff previously, or actually I would say I would prefer for you to just leave it in your car. Don't bring it into the building. That energy can just be really toxic. But the boundaries between these two spheres are completely blurred right now. At the same time, we're sharing that same collective trauma as the communities that we're providing services, resources to, and we have to continue to acknowledge that. We have to have a better approach for our team's longevity's sake. So how do we take steps to manage those stressors and to really help with balancing those different dimensions of wellness? And so here are some suggestions for you. Encourage you to track your stressors. So keeping a journal for a week or 2 weeks just to help you to identify situations that are creating the most stress for you and how you might respond to them. In this journal, you can record your thoughts, your feelings, maybe information about the environment that may have been triggering for you, people, circumstances, etc. And then talk about what you did. How did you react to that? Were you choosing something such as going for a walk? But really taking those notes, they can help you to find patterns among your stressors and your reactions to them. I want to encourage you to develop healthy responses. So instead of attempting to fight stress with food or chocolate or wine, and I'm not speaking from experience here, but doing your best to really make healthy choices when you feel that tension that can start to rise. Exercise is a great stress buster for that, but other folks may be more wanting to do something that's a little bit more relaxing to help them to calm down. There's no right or wrong with that, but just learning and evaluating what your healthy responses are can certainly be advantageous there. Establishing boundaries. Boundaries is like the new word of the buzzword of 2023. It used to be burnout, now it's boundaries. And so learning at how to establish boundaries, and really in today's world, and especially since the pandemic began, it's easy to feel pressure to be available 24 hours a day. So establishing some work-life boundaries for yourself will be really helpful. People really have different preferences when it comes to how much they blend their work and their home life together, but creating those clear boundaries between these realms can really help to reduce that potential for work-life conflict and the stress that can go along with it. Taking time to recharge and really looking at finding ways to avoid the negative effects of chronic stress and burnout. Everyone needs time to replenish and to return to our pre-stress level of functioning. And so this process, this recovery process, it requires the switching off from work and having periods of time when you're neither engaging in work-related activities or you're thinking about work. And so that's why it's critical that you disconnect from time to time in a way that fits your needs and preferences, as well as the employer's. Learning how to relax. I can't tell you how many conversations I've had in the last 6 months, especially from those that are working in caregiving type fields in the hospital systems, saying, I just don't know how to relax. And so for some of us, excuse me, this is a really foreign concept with working in kids, school, those day-to-day activities. There are techniques such as meditation, deep breathing exercises, mindfulness that can really help melt that stress away. And you can start very small by just taking a few minutes each day, and building that to be something greater, but really learning at how to relax will be helpful. And then lastly, looking at talking with a supervisor or leadership within your organization, it really is not about laying out a list of complaints, but rather to come up with an effective plan for managing stressors that you've identified so that you can perform at your best at the job and then also still be present in your life outside of work. And then lastly, I want to encourage you to not be afraid to ask for any type of support. Many organizations do have an employee assistance program. There are a variety of other offerings that you can use, such as the Stay Well program, or reaching out, but looking for that support, whether it's professional or from familial members, friends, colleagues, etc. So we've talked about a lot so far today. So how do we take all that we've discussed today, all that we've been through previously, the challenges, the stressors, the loss, the uncertainty, and how do we learn to grow from it? How do we learn to focus on wellness and our various dimensions of wellness? How do we learn to unfreeze from where we are and honor and respond to mental health challenges we may be experiencing, supporting ourselves, supporting our teams, managing those stressors, and still move forward? There is a lot on our plates right now, but it's essential that we continue to heal and to grow. So as we begin to conclude, I want to just take a moment to reframe here. So there was research that was done in the mid-90s by a gentleman named Arthur Frank, and he offers insights into how we process a crisis with an indefinite timeline. In his book, it's titled The Wounded Storyteller. It was really focused on individuals that were chronically ill, but what Frank found was that there were 3 typical responses to experiencing chronic illness. So the first were individuals who yearned to go back to the way things were before they became ill. And they're engaging in what's called a restitution narrative, in which they talk about how much better their lives were before their illness. Second are individuals who have lost sight of the past, but they can't imagine who they could be in the future. And they exist only in the present moment, and they tell very much a chaos narrative. And then third are those who embrace a quest narrative, really meeting their unchanging circumstances head on. They're accepting them, they're incorporating them as part of their identity and part of their journey. So not surprisingly, the patients who thrived despite those chronic conditions, they chose to go on that third narrative and see their illness as the occasion of a journey that becomes a quest. And so the pandemic experience can be viewed through a very similar lens. Dealing with its residual challenges will involve embracing a quest to move forward, that ability to grow and to develop despite times of change and stress, and that's essential for resilience. So what do we need to be able to move forward? First and foremost, we need safety. In order to move forward, we have to feel safe within our community, safe with others, safe in the relationship that we have with others. We also need calmness. So finding ways to calm ourselves, to relish in these calm moments and encourage others to do that as well. We also need self and team efficacy. So in other words, we need to be able to set and meet realistic goals, both on our own independently as well as part of a team. And so this may involve reevaluating goals and determining if they were realistic or not realistic. We need social connection, and we have learned so much about isolation and how severely it impacts people. And lastly, we need to have hope or optimism, or the quest, if you will. We have to have hope for a brighter future. So these 5 essential elements, they form the foundation of psychological first aid, which is an evidence-based, resilience-focused framework. And it's also the foundation of the Stay Well program. And it really directly feeds into our 8 dimensions of wellness. So we've covered a lot today in a very short period of time, and some of this is heavy in terms of reevaluating our current habits, our needs, our desires. But at the end of the day, we want to remind you to be kind to your mind, and we can help you with regaining hope for a brighter future. The phone number that is listed here on the screen is for the Stay Well Counseling line, which is available 24 hours a day, 7 days a week. If you need emotional support or just need someone to talk to about how you're feeling, I would encourage you to call the number to be connected to a trained crisis counselor who's available to speak with you. There are a variety of other resources that we have that are available. And one that I'm very excited to share with you all, is our mental wellness toolkit for organizations. So as you look at wellness within your own workplace, we would love to help to support you with this. We've launched a comprehensive toolkit to help to promote mental wellness within organizations. The toolkit is completely free of charge, and it's available on our website. You can download and or print all of the materials within the kit, or pick and choose what will best be of support for your organization. We really want to encourage employers to offer these additional options for encouraging wellness at work, and understand that some organizations don't have the bandwidth to create their own, or the EAPs may not offer what I like to refer to as kind of a plug and play. And so we've done the legwork for you. Again, this is just launched and available on our website for you to use. And then lastly, additional items that are available for free on our website. You can register for online discussion groups. There are a ton to choose from, either English or Spanish speaking. Sign up for wellness workshop series, videos that we have, recorded webinars, coping tips, and a variety of other free materials that we would love to send to you free of charge, to encourage you and your colleagues to continue to be kind to your mind, and just so much more. And there's always new material that we are releasing and publishing out. So with that, I'd like to thank you for your time and your attention just throughout this short period of time together. Sean, I'll turn it back over to you. And if there are questions, happy to help answer any of those.
Sure, absolutely. Thank you so much. And I will quickly turn it over to Nicole, who's going to help us lead us through the question.
Wonderful. Thank you, Sean. Erin, in reference to the chart that you shared earlier in the presentation, how long does the typical reconstruction period of recovery last?
That's a great question. And the chart that I showed was really based on natural disasters. So it's a one-time type of event. So to say a specific timeline and put a parameter around that, I don't know that I can do that, because everyone is healing very differently and at different rates. But typically that chart is based on a 1-year event when it looks at that reconstruction phase as well.
Wonderful. Thank you. And what's the first thing someone should do if they are seeking wellness resources?
If you're seeking wellness resources for an organization, am I understanding that correctly?
Correct. Yep.
So I would encourage you to go to our website and check out what we have to offer. It really kind of lays it all out for you quite nicely, if I must say so myself, in that it's giving you information for the managers and how to implement this. It's giving you PowerPoint presentations that are scripted and ready to go, and you can add in some of your own content as well. And there are a variety of other ways to really set up those wellness programs, and can be a great adaptation for you, or a great addition, excuse me.
Wonderful. Thank you for that. And it looks like we have one more here. A major issue is workforce shortages since the pandemic, where roles lost during the shutdown were never refilled, leaving the current employees doing significantly more work to compensate, adding stress and feeling undervalued and underpaid. How does one approach employers to combat this new normal practice?
That is a tough question to be able to answer. There are multiple different situations, but I think you have to look at your overall team and really evaluating where is the team at overall. And there are some resources that you can use to do that. One is called the ProQual, PROQOL.com, and they will actually give you these self-assessments for level of burnout, et cetera. And so you look at that overall, and then you can take those numbers and share with leadership to say, hey, look, we're really being affected here, and we're really needing to make some changes to balance this because we're all experiencing this burnout. And what happens is burnout employees, they're either going to stay and continue to burn out, or they're going to leave again. And so they're not feeling as though they're valued or they're being heard. And so it's really an inclusive conversation to kind of rebuild and support those staff to maintain and hopefully then grow your organization.
Thank you for that, Erin. And it looks like we are at our time, so I'm going to shoot it back over to Sean for our closing.
Awesome. Thank you, Erin and Nicole, and Erin for the presentation today. And as she mentioned, all of this, and as you saw in our Q&A, all of this will be shared out in a follow-up email that'll be posted on our website at michigan.gov/workplace mental health, including the slides that include the contact information that Erin shared for DHHS and herself. So make sure you check that out. We'll be back to our normal flow in June, as I mentioned. Please join us on May 31st as we close out Mental Health Awareness Month with that riveting introduction to the 4-day work week research that UK and Boston College kind of came up with. And I really appreciate you all taking the time to join us. And thank you so much again.